And the reason that a lot of traditional providers are hesitant and why you have not heard of a lot of women getting prescribed testosterone through traditional medicine is they're scared or undereducated and still living in the shadow of that bad science that was propagated back in the 2000s. Hello, and welcome to the Weaponized Body Podcast. As always, I'm your host, Dr. Ryan Hewitt, and I'm here today with a hot topic as usual. This one is maybe going to hit some buttons with some people, I hope. And hopefully, this will open some eyes for others and really discover what you want to be looking for when you are on a journey to optimize your health. If you are looking to get into the biohacking space, or just optimizing your physiology, especially when it comes to your hormones. What I'm going to do is, being in this space for a couple of years now, I'm going to talk about some things that I see routinely when people come to see me that have been through sort of the cookie cutter experience, because hormone clinics are popping up everywhere now. You've probably noticed that there's all kinds of them now. There's even, med spas that are offering GLP-1s, peptides, even, testosterone optimization strategies that are like non-medical supplements. Anyways, there's lots of like buzzwords, catchphrases. People are getting like, oh my God, yeah, my hormones are important, especially as I age, or women, especially as they get towards the menopausal stages. So what I want to call out today is some of those cookie cutter programs and how those are doing a huge disservice to some people that are actually looking to optimize their health, their wellness, their fitness, their performance, their health, their recovery, and some of the things that I'm seeing out there that are no bueno. And, of course, I'm going to give you a little plug for what I do also, because I think what I do is phenomenal. We definitely are competing on quality when it comes to this space. People get what they pay for. I like to under promise and over deliver with everything I do, but especially in this space, because there's so much noise. I just want to kind of clear some of that noise and give you guys some insights on what some of the things you should be looking for when you're thinking about getting into, whether it's optimizing your testosterone as a man or a woman, whether you're looking to get into doing some peptides for athletic performance, for anti-aging, for biohacking or whatnot. So let's talk. So let's talk about the cookie cutter program problem. First of all, when it comes to testosterone replacement therapy, this one drives me nuts. I can't tell you how many guys that they'll come to see me to do blood work because they sense that what they're getting is something that is suboptimal. They're just like, yeah, it's kind of a set it and forget it. I don't really stay in touch with them too much. I'm sort of on this auto ship thing. And they're getting like a 0.5 ml of cypionate testosterone twice a week injection, or worse, they're instructed to do a once a week injection of, anywhere between 0.5 to 1 ml, which is 200 milligrams. And they're getting, instruction to do 0.5 milligram of anastrozole once a week. No matter who you are, no matter what your blood work says, no matter how low or high your T was, this is what you get. So that's a massive problem. It's lazy medicine. It's, prescribing from a template. And let's be real. Like, first of all, mismanaging somebody's hormone levels is problematic because testosterone has major effects on the entire body, not just putting on muscle and libido. We're talking your brain chemistry. We're talking it has major effects on other organ systems. So you can definitely play this game wrong and cause some harm. With the anastrozole specifically, so we're talking like the tamoxifen, anastrozole, we're talking the aromatase inhibitor drugs to prevent testosterone from turning into estrogen. So the game they're playing here is like, okay, we're going to put these folks on a dose of testosterone where a bunch of it or some of it might aromatase into estrogen, especially if we're overdosing the testosterone. So we want to suppress it with this med. The problem with that is anastrozole, tamoxifens, those anti-aromatase or those aromatase inhibitor meds are very toxic. Uh, it's estrogen's not the enemy. So this is something that we must understand, that estrogen is super critical for heart health. It's very important for bone density, for brain function, and majorly important for sexual health, especially in men. So taking these aromatase inhibitors recklessly can wreak massive havoc on your body and your results and your libido and on your tendons and your joints. I consulted with a guy once that was getting that recommendation, and he was having like chronic joint pain. So I got him off the aromatase inhibitor, optimized his dose, and lo and behold, couldn't be happier. He's crushing it. No more joint pain. So and this is a really common thing I'm seeing. Let's talk about number two, minimal to incomplete blood work. A lot of guys will share their labs with me. Usually most of these clinics that are doing sort of mass people are doing labs through LabCorp or Quest. So they're looking at minimal labs, like they're looking at testosterone, estradiol, perhaps a couple other markers. Maybe they're looking at FSH, LH. Maybe they're looking at sex hormone binding globulin. Maybe they're looking at a bit of organ system stuff if you're lucky. Rarely I see cholesterol. Rarely I see ferritin. Rarely am I seeing routine CBCs. So this is a massive, massive problem because, like, if your A1C or your blood sugar is left unchecked, okay, that could cause obviously massive metabolic distress. That testosterone can amplify those problems. If your blood pressure is uncontrollably checked, or is checked uncontrolled, that's a massive problem. They call it the silent killer for a reason. Now, testosterone can and has been known to raise blood pressure, especially when doses are irresponsibly high. Okay. Super physiological doses that are not in the natural range. Okay. What happens to this additional testosterone? Well, your body uses some of it, it transfers, some of it, it does all kinds of other stuff, sometimes undesirable, like raising blood pressure. So cholesterol also is affected by testosterone. In a lot of cases, unfavorably, it can increase LDL, lower your HDL. In other words, increase your bad cholesterol, lower your good cholesterol, especially if you're not training and eating properly and sleeping well. So, number one, on my labs, we always get advanced particles tests. So we definitely check cholesterol, but we also want to check things like ApoB, which tells me about particle size. It tells me, is this person like a walking disaster when it comes to their heart disease risk? Do they have blood pressure problems? We need to be checking blood pressure. When it comes to kidney health, okay, we need to be checking kidney health. So not just creatinine, not just BUN, but also GFR, okay, filtration rates, and also cetacean C, much more indicative of how healthy your kidneys really are. We got to be checking liver health too. Okay. Testosterone is processed through the liver. It can raise liver enzymes. AST, ALT are not necessarily liver enzymes, they're transaminases. They do elevate if you have more skeletal muscle mass, but there's another one called GGT, which is much more indicative of actual hepatic or liver health. So those are some tests that are not even that expensive. Very, very important to be monitoring these things to make sure their organ health, comprehensive metabolic health is intact. So these are just small examples. Like, okay, CBC is another big one. Your complete blood count, making sure. So one thing testosterone does is it increases erythropoietin. So in other words, it increases your body's ability to produce more red blood cell, okay, more oxygen carrying capacity. So your hematocrit and your hemoglobin can elevate. What happens with that is your blood can start to thicken. You do not want thick blood, especially when it gets too thick, because then you become at a higher risk for clot and stroke. Okay, you need to be watching these things. You need to be checking your CBCs, and also the blanket instruction along with this, like half a mil of testosterone twice a week with half a milligram of anastrozole. They'll say, well, do routine phlebotomy, every 3 to 6 months. This is a major problem also. You can't just donate blood and lower your hematocrit and hemoglobin by dumping blood, a pint of blood every 6 months, if your ferritin levels start to shrink. Because what happens is your ferritin goes down when you donate blood. That's your storage form of iron. Then you can create an anemia issue while your red blood cells and your hematocrit are high, and then you're really fucked. Then you're in a serious situation where trying to finagle yourself out of that one's going to be difficult. You're going to need medical intervention. So the whole solution to this is get responsible oversight and dosing. Okay. That fixes all those problems. Making sure you're getting, good care, good quality care. Number 3 is bad delivery methods and ignorant prescribers. So I've seen anything as crazy as one shot a month, one shot of testosterone a month. I swear to God, I had a patient who was getting one shot of testosterone a month. I don't even remember how much it was. I don't know if they were just blasting them with like 400 milligrams or what. I've seen anywhere from once a month to twice a week. Most of the time, it's once a week. Now, the problem with infrequent dosing of testosterone is that you get these major peaks and valleys. It is not a natural roller coaster for your hormones to be on. And when that happens, that is what is responsible for a lot of what your body needs to do with this excess androgen. So it starts to convert it to estrogen, and all kinds of other physiological things occur in the body, most of them undesirable. You're always better off doing smaller doses more frequently. Okay. And this is what I found with most of my men, especially. So what are some other and this is injectable, right? So I like injectable intramuscular injection because it is the safest delivery method when it comes to controlling your hormone and any undesirable effects. When you're talking subcutaneous dosing, it's a little less desirable. You have to do really small doses if you're going to do that under the skin. Intramuscular, you can do more dosages. And, is one more painful than the other? I don't think so. I think they're pretty comparable. But intramuscular is better. Subcutaneous is, I would say, not as good, but okay. And when you start getting into other things like creams and gels, here's the problems with creams and gels is you start running into not knowing really what kind of dosing you're getting because you're kind of just like squirting it out or however the delivery method is out of the container, and you're kind of like slathering on yourself. How much do you absorb through your skin? Is it actually getting into the lymphatics and bypassing the right systems? Or is it rubbing off on anything? Are you forgetting dosages? So yeah, the creams are messy. I don't really think you can control the dose very well with it. This goes for both men and women. And the pellets, I get guys ask me about pellets all the time. I hate pellets. Pellets, I think, are just like kind of the, I hate to use it, the sissy way, or like the lazy way. It's like, oh, I'll just throw a pellet under my skin every 3 months. First of all, it's a surgical procedure. A lot of times your body can reject that pellet. It will, bring it to the surface and try to get rid of it. That should be an indication your body doesn't really want that shit under your skin. Um, Again, the dosing is very unpredictable. Everybody absorbs at a different rate. You can't really control the dose at all when that thing's in there. It's like, okay, so I don't really like the way what your blood chemistry looks like. What are you going to do about it? Well, you can only really treat it with more drugs then, which if you don't want to be treating your blood with more drugs, then just do the smarter thing and control the dosing in other vehicles like intramuscular injection. So I think the pellets are the worst. Um, I guess the best would be intramuscular injection. Second best would be sub-Q. Third best, and something that's starting to become more and more popular, is the troches or the sublinguals. So this does bypass the liver because it is absorbed through your lymphatic system. This is what I'm doing with most women now, is we're doing testosterone troches that are sublingual. So my medical provider, my medical director, really, who's amazing, she really likes the troches for women, and they seem to work fantastic. For men, I have not experimented with too many men with the troches, but to me, I think the troches is a better delivery than, say, the creams or the pellets. So we're talking about just more precision. You're going to find by the end of this, it's like you want quality, you want precision, and you want to be watching these things routinely. So let's get to women, and the tragedy that is the testosterone situation with women. Most women never even get offered testosterone. This is probably one of the most common things that have helped women that I've worked with, that my medical provider and I have worked with. Progesterone and testosterone have worked wonders for many, many, many women that I've seen. And the reason that a lot of traditional providers are hesitant, and why you have not heard of a lot of women getting prescribed testosterone through traditional medicine, is they're scared or undereducated and still living in the shadow of that bad science that was propagated back in the 2000s. You may have heard of a study called the Women's Health Initiative Study, the WHI, right? It was a massive trial in the early 2000s. And this is what scared millions of women and doctors away from hormone therapy for women. The headline said that HRT caused breast cancer, heart attacks, and strokes. And this is where a lot of medical providers panicked, and it pretty much escaped the standard of care. And we said, well, we don't look at hormones at the blood work. We don't talk about hormones. We pretend they don't exist. And if you want to go see someone about hormones, you go see an endocrinologist. And even then, the endocrinologist rarely, if ever, prescribed any sort of hormone therapies, especially not testosterone. But here's the truth, and this has come out like it's come out now that this women's health initiative study was deeply flawed. First of all, the populations of women that were used in this study were older women. So many were way past menopause already. Many of them were already unhealthy women. Okay. And they didn't use bioidentical hormones with this study. They used synthetic estrogen and synthetic progestins, which are not the same thing. They lumped all this data together and pretty much propagated the fear that, wow, we're giving people cancer by giving them hormone therapy, which is totally false. So millions of women, especially perimenopausal women, in the last 20 years plus, were I think we're given a humongous disservice because practitioners were too scared to address the hormone situations. Now, here's the thing: like, as a chiropractor, as a functional medicine practitioner, I am somebody who always wants to lead with lifestyle and natural solutions first. However, what I found, that now that I've done blood work with hundreds and hundreds of people, is that there are like, I see way more fucked up blood work than I do pristine blood work, even in people that are doing quote unquote the right things. And I'm convinced that our world today is so full of toxicity and deficiency. And there are so many things that can accumulate through your lifetime that, listen, there is sometimes is only so far you can get with natural methods. After that, we have um, technology today. We have advanced therapies with minimal side effect that is safe and effective, that is available to you, right? To increase your quality of life, your performance, your health, your recovery, and your longevity. So why would you be opposed to that? I certainly am not. I'm a huge proponent for being proactive and helping a lot of these women that were given a disservice and are continuing to get a disservice by not addressing important things like low testosterone, low progesterone, and estrogen dysregulation issues. So it is not dangerous if it's done properly. It does not masculinize you as a woman if you're taking low dose testosterone. If you're deficient and you need it, it's definitely a necessity for a lot of people. So women also make testosterone. If you didn't know, it's super important for strength, super important for energy and libido and mental clarity and metabolic health. When it declines, your quality of life also declines. It's like directly connected. So withholding this important therapy from women out of fear or ignorance is just plain wrong. So enough of that. Let's get on to number 4. So insurance games and lack of routine labs. So there's a lot of folks that I'll do labs with, and they'll invest the money to do labs with me because they cannot get comprehensive labs through covered by their insurance, through their traditional physician. By the way, I am not doing this podcast to bash anybody, to throw anybody under the bus, or to, um, you know, throw any medical practitioners under the bus. I mean, listen, I think that everyone should have a primary care physician. I think most primary care physicians are phenomenal. I just think that they're beholden to a model of health that is not there to serve you to get you healthier, to help you be proactive, and also to help you optimize. Okay. They're not there to help you optimize. So it's not their fault that your routine labs are only 19 biomarkers. This is why it's so important to make sure that you have money that you're investing in your health. Okay. So insurance does not pay for optimization. I'm going to say that again. Your insurance will not pay for optimization. Whether that comes to lab tests that you want to get to see what's going on under the hood, whether it's your supplementation, whether it's your peptides, whether it's, your hormone replacement. I know there's some people that get their testosterone and their progesterone and their estrogen covered by their insurance. It's rare. It's rarer than it is common. And trust me, I am a proponent of, hey, if you can use your insurance, please, go for it. I will do whatever I can to help you save some money, utilize that health insurance you pay thousands of dollars for. But here's the problem is insurance is designed to pay for sick care. It is designed to pay for when you're sick, when you're in a health crisis. So listen, if you're someone who has low hormone and you have symptoms like, yeah, are you in crisis? Sure. But it's not in the standard of care that, hey, like I have a bit of low libido. I'm having problems putting on muscle and my joints are sore. I'm a 40-year-old guy. My testosterone is 350. Sorry, sir. We don't do that here. Hey, I can't get that covered by your insurance. I don't play that game. Like, listen, when your doc doesn't want to do it, like, don't be angry at them. Okay. It is not their specialty. It is not in their best interest to try to manage a lot of people doing testosterone programs, because listen, doing a testosterone program is no joke. You have to be very serious about it. It is not something you just dabble with and just like, no big deal. Like, you need to be on it. You need to be dialing in the dose. You need to be doing routine blood work, routine labs. You need to be really on top of your health. Okay. You don't want to be adding androgen hormone to someone who is metabolically unhealthy already. You're going to they're going to become even more unhealthy. So trying to if you're trying to wedge, let's say, hormone therapy into what your insurance will pay for, and your doc is willing to do it for you, okay, great. Just know that you're not going to get optimal dosing. You're not going to get, optimal labs to make sure you're monitoring. You're not going to get lifestyle modification recommendations. You're not going to get supplementation, um, assistance to help you minimize the problems that can happen from taking androgens, peptide assistance, etc. You're not going to get these things through your primary care. Now, if you want to do it that way, power to you. Just know that is not the optimal route. There are very few primary care professionals that, want to prescribe testosterone, let alone, if they do it, will be able to help you the way you want. So find a place that does this specialty. Okay. A place that is going to test your blood every 3 to 6 months. It's going to help you optimize your dose. It's going to help you minimize and reduce harm. It's all about harm reduction. Okay. And make sure they know what they're doing. Number 5, I see this one a lot too. You have a revolving door of practitioners that you see every time you consult someone about your labs. So you're on this testosterone dose, maybe they gave you a peptide or something. And every time you get your labs done, you get the email and you go to LabCorp and you get on the phone. It's like, oh, it's a new person. It's a new nurse practitioner. It's a new clinician. And these people know nothing about you. All they have is your notes. They got your labs, maybe your previous labs, and they know nothing about you. They don't know, anything about you other than a few numbers that they tested. and what you're currently taking as a dose. Now, it's better than nothing, but here's the thing. Would you rather see a doc that knows you well, has been consulting with you for years, sees your blood work, routinely knows the lifestyle recommendations that you've committed to doing, has given you supplement protocols, is dialing in your dosage as, we see the blood change, etc., depending on your lifestyle. Like, that's personalized medicine. That's what you want. That's what you want to pay for. That's going to be precision optimized medicine, not a place where you're just another number and we've got a revolving door of practitioners seeing you every time. So the last one is sort of like a little quick hit that I'm not going to get into every little nitty gritty, but if you're not getting any lifestyle coaching from your hormone optimization clinic, like, there's that sucks. Okay. It's ignorant to be ignoring somebody's sleep, training, nutrition, stress management, and water intake. You got to be asking people about their lifestyle. Okay. It has a massive effect on how well your hormone program is going to work, how to minimize any harm, and to make sure you're maximizing your results. If you're not getting any education, if all you're getting is just prescriptions thrown at you, that's a red flag. If you're not getting any personalized dosing or personalized delivery methods, like, you might be needle averse. I get it. What are the options? What are the best ways to make sure you're controlling the dosing? When are you going to retest? How are you going to make sure that this plan works? And places that are just pushing peptides and supplements without a plan or a follow-up, like, those are all red flags to me. So I'm going to promote what we do at Weaponized Wellness now, after going over those. Um, when we do blood work, there's really two panels that I run on everybody. We can customize appropriately, but we run at least 45 biomarkers on our basic panels. On our VIP, we're running at least 85. This gives me a really strong understanding of what's going on under the hood in multiple avenues of metabolic health, of your cholesterol, your liver, kidney, muscle, thyroid, comprehensive hormones, cholesterol, vitamins, minerals, nutrients, etc. It is really, really important to see that stuff and make sure that it is really easy to go sideways in this life when it comes to your habits. So we're able to call out people on their habits. I can tell if someone's drinking enough water. I can tell if somebody's been taking their supplements routinely. I can tell if they've been taking too much testosterone and not following the dosing. I can tell when they've been sideways with their eating. Like, there's nowhere to hide. You cannot hide from blood work. And this is what people pay me for. They don't pay me to, like, just be their dealer. Okay. They're paying me to make sure that they get fantastic results with their health, right? We individualize all of our protocols. Okay. And this is based on routine, regular labs, making sure that our dosing frequency, our compounds are tailored to the appropriate, making sure that they get the proper dosage, the proper, hormones, as well as supplementation. In a lot of cases, there's people that need gut repair. They need like adrenal support, and so on and so forth, along with their hormone optimization and peptides. So lifestyle first is how we practice at Weaponized Wellness. We're always leading number one with what is the most natural approach. Is this something that we can approach naturally first with lifestyle? Or is this something that we've tried, these things, and this is as far as we're getting, and now we're ready for assistance? Okay. It is very, very important. Nutrition, training, sleep, supplementation, water intake, and so on and so forth, making sure we're pulling all the levers. Because listen, if you want to optimize and you're not doing the work, then you're not optimizing. Okay. I call those bio slackers, not biohackers. And of course, the continuity in your care. You are seeing the same routine, regular people always who know you, we take fantastic notes. We have a fantastic system of tracking, making sure we do routine labs, and we're monitoring before and after results. We're always helping you dial in your program. You're not getting a different person every time, who knows nothing about you. So here's the bottom line. If your clinic looks like what I described in those like multiple red flags, like it's cookie cutter dosing, or incomplete labs, it's a revolving door type of thing. Like, in my opinion, that sucks. Okay. You usually get what you pay for though. You deserve better. You need to invest money to do better, to make sure you're protecting your health. And this is why I built Weaponized Wellness, because I saw, um, and myself participated in some of those clinics that were doing that, standard of care. Um, and it's not sick care. Okay. It's about optimization, performance, living at the highest capacity. Right. So if you're willing, so first of all, if you're someone who is like sick of the assembly line, like Hormone Op Clinic, like weaponizedwellness.com, check us out, schedule a consult with me, and let's talk. If you're someone who's, always been wanting to know, what's going on under the hood, what do my hormones look like? Same thing. Check us out, get some labs done, or, visit somebody is a phenomenal practitioner who's willing to go the distance with you, spend the time with you. I spend 45 minutes with folks initially, going over all their labs, explaining everything to them. That's usually the number one thing that I get is like, wow, I've never had anybody go over my labs with me like this and just teach me about these things and what's going on. So people want to know this stuff. They want to know what's going on. What can I do to make sure that I'm living my best possible, um, uh, my best possible life, essentially, like my best possible way to show up every day. So I always appreciate you guys listening. I hope this delivered some value to those of you who either are someone who is a healthcare consumer when it comes to hormone optimization, or you're looking to get into finding out more about it. Check us out, weaponizedwellness.com. As always, you can DM me, the Weaponized Dad, on Instagram, Dr. Ryan Hewitt on Facebook. I'm always here for you guys to answer any questions you have. As always, like, share, and rate and review. And I appreciate you guys. See you next week.